From medical media, this is The Ortho Show.
Hello world, Dr. Scott Sigman. Yes, your favorite opioid-sparing orthopedic surgeon here for another episode of the Ortho Show podcast. I am fresh back from the academy, and I want to thank everyone there who spent so much time coming up and shaking my hand and taking pictures. It was phenomenal. I literally had about 30 medical students and residents from around the world that listen to our show. They're passionate about our show, and they've learned so much from the inspirational stories of guests like our guest today, Ken Cutbush. He is my brother of another mother, a shoulder surgeon down in Brisbane, Australia. He's in private practice, but yet still maintains an academic focus as well. He has an internationally renowned shoulder fellowship with Ashish Gupta as well. And what a pleasure it is, Ken, to have you on the show today. Thank you for taking the time.
G'day, Scott. Wonderful to be here.
No, fantastic. And, let's get started. This is how we always start the show. It's always a little bit about the initial background of our guests. So I'm assuming, you've got that Australian accent, born and bred down in Australia, right? For the whole time. Is that what we got?
Yeah, born in Brisbane and working in Brisbane. It's a great
Fantastic. First doctor in the family?
No, my sister was a doctor. My mum, she wanted all of us to go to university, and she was very excited that the four children got to university. My sister and I are both doctors. My sister's a psychiatrist. I've got a sister who's a speech therapist and a brother who does computers. Yeah.
Okay. So there was a medical background there, and I think we do our research here. It sounds like you were a little confused early on, and you were thinking about neurosurgery, but then you found the path to bone healing and orthopedic surgery. Is that correct?
Yeah, that's it. Yeah, I started off doing neurosurgery and then changed and really thought about what I wanted to do and ended up doing orthopedics and then went into upper limb surgery and then focused down on the shoulder surgery, which I really enjoy.
It reminds me, we're going to talk a little bit about this as we get into our shared history, but you remind me of an individual specifically, and that's Loren the Foss.
Yes.
Loren was, everybody just assumes that Loren is this amazing academic professor, but at the end of the day, he's in a small village, Annecy, and he decided early on he was going to be a vascular surgeon and the brachial plexus and operating on nerves, and that allowed him to really sort of think about upper extremity surgery and shoulder surgery from a different perspective. And I feel that same way for you.
Well, I had dinner at Laurent's house one night when I went to visit him and with his fellows. And he told me he actually did some neurosurgery to start with. So we sort of bonded over that, actually, before he became a shoulder surgeon. But he was a fantastic guy. Well, he is a fantastic guy, a fantastic surgeon.
Yeah, well, we both share that. Let's talk about it a little bit. So for me in particular, as a skilled surgeon, I was doing all these soft tissue surgeries. And I remember my mother Judy's listening. So as we talk about techniques, we got to make sure that everybody understands. But we used to only just do the Bankart, which was the soft tissue repair. And we had these high failure rates. And then one day, my buddy and I, Sharif Bichet, is an orthopedic surgeon from Detroit, we packed our bags and we shipped off to Europe, and we spent time with Loren LaFosse, and then we spent time with Matthew oh my God, why am I blanking? Matt Ravenscroft in England, and we went and learned this operation. So what was it for you? Why'd you do your walkabout and hang out to Europe? What do you got?
I did the Australian, the Shoulder and Elbow Society of Australia had a travelling fellowship to Europe in conjunction with CSEC, and so I went and did that. And I didn't see Laurent on that time, but I saw Pascal Bouillot and several of the other amazing guys over there. And I came back just wanting to do shoulder surgery after I'd seen it and deciding I knew I needed to sort of specialise further. And I'd been at the first Annecy course when Laurent presented his arthroscopic lattice procedure, and I'd seen Pascal do his arthroscopic procedure, and it just excited me. And so the first thing I did when I came back was actually run a private practice and said to my staff, right, that's it, no more elbows, no more hands. I'm just going to do shoulders, and that's for a year. Things were pretty quiet, and I just concentrated on learning shoulders and getting right into the depths of it. So every rotator cuff that came in, this is 20 years ago, almost 15 years ago. So it was at the time when there was that transition in Australia from open to arthroscopic rotator cuff repairs, and I just spent my time doing everything arthroscopically, and I did that for a year. And every day I thought about doing an arthroscopic latter, and finally we came around to doing an arthroscopic latter, and it was a wonderful thing. Yeah, it's a confronting operation when you do it.
A confronting operation. We're two countries separated by the same language. I would say it scared the hell out of me every single time I did one. The night before I would lose sleep. I'd toss and turn. I would get it done, and I just want you to know that Pascal Boileau, just so you know, you're in great
Yeah,
company. He'll be our guest that's actually getting released next week. So I
I think
think
so.
we'll have you on about 2 weeks after. So you're in good hands here with the Ortho Show for sure.
Yeah, yeah, his drive and enthusiasm are just incredible. But I've now just recently done more than 400 arthroscopic latter,
Oh, that's
which is
fantastic.
like
That's
numbers.
crazy,
I
crazy
think
good.
things change, yeah. And I say to my fellows, I get that no one really wants to do arthroscopic latter, and I understand that completely. But you learn skills from it, then transfer into other parts of shoulder surgery, and that you get those skills from doing the latter.
I think that's wonderful, and it's so true. First, so again, for our listeners, I would argue that the arthroscopic latarjet is like climbing Mount Everest for a shoulder surgeon. It is a daunting operation. It's a very steep learning curve. You're not taught the anatomy, but once you learn the anatomy, just like you said, you can become a master of the front of the shoulder, and you can start
Yeah,
doing subscap repairs and biceps repairs. So it's really great to understand the anterior, the front
yeah,
space of the shoulder as you go through that. But 400, my God, that's amazing. You are
that's
the
pretty.
Australian master of arthroscopic latarjet for sure. So
Yeah.
I know that education. So you spent a lot of time, developing your own skill set, right? You've always pushed yourself outside the box. You weren't going to stay with status quo. You were going to go and learn from other surgeons. And education is very important for you and your partner, Ashish Gupta.
Yes.
By the way, the two of you are everywhere. By the way, Ashish and I were
Well, she's
teaching.
perfect. Yeah.
Yeah, he's wonderful. At the Dubai shoulder course, I was there on invitation, and she couldn't make it personally, but he did come in and do a video. And then I'm hanging out with Andy Carter and the Tetris crew, and they're always talking about you. So it's great that we're
Yeah.
making this connection. So, but education's a passion for you, not just for yourself, but now you have a very important shoulder fellowship as well. Tell us a little bit about that and why that's such a drive for you.
Yeah, well, the Shoulder Fellowship is wonderful. We've just started this year with our fourth fellow between the two of us, and we take fellows from all over the world. We've got a wonderful guy, Joma, Dr. Joma has gone back to Lebanon, and he's now the first shoulder surgeon back in Lebanon. We've got Manny Singh, who's just gone back to Kathmandu. We went over and did a course with him at his hospital. It was just wonderful. We took our crew over with our fellows, and the Sheesh went over, and we spent a week there in Kathmandu in Nepal, and that was a wonderful experience. They're bringing shoulder surgery to Nepal now. And we've got Roberto has just gone back to Mexico. So we have these, and we've got Freek Holman and Bart Van Gien back in Netherlands, and then we've got the list goes on. We've just got these amazing guys that come and work with us, and then they go back to wherever they come from, and spread shoulder surgery, which is fantastic.
It's amazing. I mean, do you know George Athwal personally from
Yes.
Canada?
Yeah, yeah. I've stayed with George at his home in London, Ontario. George is amazing.
Amazing, right? Another one of these
Just
just
amazing.
phenomenal rock
Yeah,
star, intellectual
he's a rock
people.
star.
And just like yourself, what I admire so much about George is that his fellowship is the same idea. It's an international fellowship. So often, the fellows that come here to the US, their goal ultimately is to stay in the United States. And it's harder to get the
Yeah,
fellowship here in the United States, for those reasons, as far as the visas, et cetera. But you and George are passionate about taking fellows from around the world, and then you're educating these doctors. They're going back to their home countries. They've
mm,
learned from the best, and now they can help to educate the next generation of shoulder surgeons from the place that they come, right? How wonderful.
yeah. Look, it is terrific. She's always asked me how I managed to pick all these great people, but you just look for superstars, and they don't have to come from the United States or the UK. They can come. They're all over the place, and you just have to find them.
Yeah, George has got some amazing fellows from Saudi Arabia, from Bahrain, again, around the world. And I think that it's that's an admiration on our part to recognize for you how important that education is and being able to share the things that you've learned as a mentee, now becoming a mentor and being able to share that with your passion as well. So, one of my other great passions, Matthew Ray Scott, who is my partner, my buddy, we just finished writing our book. Everybody keeps asking when it's coming out. It is coming out, and we had the privilege of interviewing you, and it wasn't
Yeah, I
by
had a wonderful
accident.
time with him.
He's
Yeah.
a yeah, and he thinks so highly of you as well. And it wasn't by accident that we wanted to interview you. I find myself, I was at the academy, like I said, the American Academy of Orthopedic Surgery. I can't go 20 feet without somebody coming up and saying hi to me, but because of the brand that I've developed, even as a private practitioner. And so you can be an academic, you can be a private practitioner, but the process of being a master brander so that the world and your patients know who you are before they come to see you. So the next time you open the door to your next new patient,
Yeah.
that patient knows that your
Yes.
brand is
Yeah.
international, it's
Yeah.
education, it's state of the art. Why is branding so important to you?
Look, I think it's important for all doctors. We are not sports stars. We're not football players. We don't have people following us around with cameras. And you have to show people what you do. What we do is really exciting. And if as medical practitioners, as doctors, if we're not out there showing the people what we do and how exciting it is, because it really is exciting. The operating is a very challenging thing that we do, and you have to show it. And I think we're taught as doctors to sort of not put ourselves out there, and I think that's the wrong way. I try and get this message out to my colleagues that if they go and give a talk at a conference, they should put it up there. And LinkedIn is such a great place for people to put things like that up. You do need to put, if you go and give a talk, all doctors should be doing this. We should be lifting the profile of the medical profession around the world, showing what we actually do. We do some pretty cool stuff. It's not playing football, but it's actually pretty cool. And so I think people should be putting themselves out on LinkedIn when they do something, just a little post. People look at LinkedIn. It's a great forum to be on, and it really does lift your profile. And the websites, I think people want to know who you are as a person. It's not so much about telling them, I'm the best at this or that. No, no, just let them get a feel for who you are as a person. On my website, I've got a little video. Have you ever been to a doctor and not been able to find where the office is? It's really hard. Most hospitals are rabbit warrens and you can't find where you are. So I've got a little video on my website of, here, let me help you find my office. This is how to find it. And people get a sense of who you are from that as a person. And I think that's great. And if they don't like you, well, then they know not to come and see you. They'll go see someone else. And I think that's a good thing.
No, I think that's great. I have news for you. You actually literally live on an island, right? It's a big island. There's no question about it. But the point is, by being a part of that, you then become part of the larger international community as well. And you are a recognized leader around the world for what you do. And let's go through this. I mean, you dress for success. It's very important to you. You're always in a suit. That's important, that process. Your office is beautiful. It is branded, right? And
Yeah.
your website is state of the art. And even here watching you, like, Chanel and I commented, you have this really cool camera. The camera, it's a motion camera. It follows you. So you
Oh,
take time. When the
that's the
technology is
makeup
important
job.
to you.
Yeah.
Yeah,
Yes. Oh,
well, but
yes.
yes.
Yeah, well, technology speeds everything up for you, so you can present things to people, and communication is really important. You know, um, I do a little video for the patients at the end of every operation. Just, you take those pictures of the inside of the shoulder. No one knows what those pictures are. So you go through and point them out and just show them, hey, this is, I just put my phone there and point at everything and say, this is what it is. And I have my x-rays and scans on my laptop and I'll go through them. And so I present their little story to them. And that's really helpful, and that's just using the mediums that we have now, the communication. We have more than a phone. Before that was pen and paper. We used to write a little note to people.
So I say this all the time. I mean, for our younger listeners out there, the residents and the fellows that listen to us routinely, like start now, start building your
Yes,
brand, even in
yes,
training, right? Because
100%.
the longer you wait, the harder it is to identify this. And like I'm assuming that there's absolutely no competition for shoulder surgeons in Brisbane, Australia. I'm kidding, right? Right. So your idea, you want people to drive by the other.
Everyone's a shoulder surgeon.
Everybody's a shoulder surgeon.
I
So
know,
you
I
want
get
your
it.
patients to drive by 30 other orthopedic surgeons to come to your
Oh,
office
that's
that you
good.
have a video on your website showing
Yeah,
them how to get there. I mean, that's important. It really makes a
yeah,
difference.
yeah.
So that's awesome.
Look,
So
I agree with you that
yeah.
yeah, look, these guys, that to get onto these programs is ridiculous. Like it's crazy. They've had to go to medical school. They've had to study for, like no one understands how much study these guys are having to do. And then they get out and their life is about work. They go to work and they go home and study every night. And they drive, get onto the orthopedics or maybe plastics programs. They're the hardest of all right now from the surgical specialties in Australia and probably in the United States. And these guys will do years just grinding to get on. And why not show that to people? It's pretty freaking cool what they're doing, and also it takes time. You have to get used to putting little posts up. You have to get used to getting the photos there and putting a little caption and just putting yourself out there. And it takes a while to get used to hitting the right note as when you're doing it too. So I
Well,
agree.
that
I think they should do.
absolutely brilliant. I mean, I love the idea of being able to share their journey, right?
Yeah.
So, right,
Yes. It's
this
a
is
big
hard
journey.
work.
Oh
It's
my
a lot.
God.
I know.
I
And
mean,
nowadays they're
I
all
love
doing
it.
research, right?
Yeah.
They got 100 papers and all this other crazy stuff that they've done. And you're going to the academy, you have a poster presentation. Share that with the
Yeah.
world, right?
100%, 100%, because people are interested in this. I don't think that everyone realizes it. And as I said, we don't have cameras following us around. You do need to put yourself out there. And I think every doctor should be doing it. There are so many fascinating things that doctors, not just surgeons, but I think, because we're surgeons, of course we're surgeons, but, the physicians and the radiologists, everyone is doing cool stuff.
Yeah, no, and I'm so glad we interviewed for the book. I can see why Matthew, absolutely adores you, and because you're all of the messages that you're talking about are so ingrained in the things that both he and I talk about as we share our brand story. Let's pivot a little bit to something else that you and I share a passion for. And so what I like to usually at this stage in my career, I just did a couple presentations about rotator cuff, and I say the first 20 years of practice, when I was taking care of patients, I literally thought of myself as a mechanic. Okay, the rotator cuff tore off from the bone. I'm going to put some sutures in it. I'm going to put some anchors, single row, double row, it didn't matter. Put a whole bunch of stuff in there and try and let's get it to heal down to the bone. And the truth is, we sucked at rotator cuff repair for a long time, very high failure rates. And so now,
Failure rates of 40%.
yes.
Overseas studies quote reliably a 40% failure rate for full thickness rotator cuff tears. That is all over the place. Multiple studies, multi-center, randomized controlled trials, 40% re-tear rates is a pretty conservative estimate of the re-tear rate of rotator cuff repair. And do we tell our patients that, or was I? No.
No,
No
no.
one's scanning everyone. People just don't scan people, just hoping that they don't see the rotator cuff the tear. Yeah.
Well, when you invite me to Brisbane and I'm coming,
I'll
and I
come.
and I and I get on the plane from Boston and the pilot, in that Australian accent says, "Hey, we're taking off, and I got good news. We're taking off, but we've only got about a 60% chance of landing the plane in Brisbane. I mean, I'm not getting on that plane, right? I mean, there's no way."
Exactly. Exactly. Yeah.
So in the last 10 years, I've really taken my biology degree from my college education, and I feel I've become much more of a biologist. I definitely feel we need mechanical, but we need biology to create augmentation, to biohack the body, to turn on the DNA of our cells to create a healing response. So what are you doing in rotator cuff repair right now from a biologic standpoint to try and trick the body into healing?
Look, what I'm really excited about is slowing down the rehab for the first 3 months because I've started in Australia. MRI scans are actually very cheap, and particularly in Brisbane. They're about 250 Australian dollars in Brisbane, which American dollars, that's great. And so I scan them at 6 weeks and at 12 weeks, and then again around 6 months and then 12 months. So, and it's fascinating. What you see is they tear between 6 and 12 weeks. So the first thing I'm doing as part of this is slowing down their rehab for the first 12 weeks because they tear related to motion. And that's changed my re-tear rate dramatically. And then I've gone through the patches and the augmentations and so on. I have not found those augments or the patches or the reinforcements particularly helpful in terms of getting patients great results. And I think they complicate the surgery dramatically and make things harder. What we have pivoted to, Sheesh and I, is using these N-fix anchors from Tetris. And what we're looking at is improving the healing. So slowing down the rehab and not allowing that rotator cuff to heal to the tuberosity, to the bone, via an enthesis.
So my mother Judy's listening. So we got to explain what an N-fix anchor is so that people know what this is about. Go for it.
So what we're looking at is rotator cuff tendons heal to the bone with scar tissue. That's well accepted. That's how everything heals with scar tissue. But that's not the way that tendons are actually attached to bone. Tendons attach to bone through a complex thing called an enthesis, which has a structure. You go from tendon to fibrocartilage to a tie mark to calcified fibrocartilage to bone. So there's a very particular structure to it, and that's how tendons heal to bone. And it gets converted to bone via little ossification centers that form in that scapula, in that shoulder blade, which then coalesce together, and the whole thing becomes converted to bone. As that process approaches where the tendons attach, the enthesis is formed. So the enthesis is triggered by the process of endochondral ossification, which is the new bone, the cartilage being converted to bone as it touches the tendon, and that's when it forms. So we can trigger that by putting a demineralized bone anchor or prosthesis between the tendon and the bone when we do the repair, so that we trigger this enthesis to form via the bone growing into this prosthesis, the Tetris anchor, the N-fix anchor, and endochondral ossification starts, and that then, as that hits the tendon, that triggers the formation of enthesis. And it does happen. That's been well shown in animals that we can trigger the formation of a proper connection between the tendon and the bone by using these implants at that interface.
So basically, we're taking.
Will your mother understand that?
No, she'll be calling me right now. Thank you very much. But I love her, so it'll be nice to have another conversation with her. But no. So you're taking demineralized bone from somebody else. It gets formed into something that can be plugged into where the rotator cuff attaches. You've got some amazingly smart people. My favorite, Australian with the New Jersey accent is Professor Bill Walsh, right? Who I actually just saw. Literally 48 hours ago, I saw Bill with his new idea. But the concept is there's some good preclinical animal studies demonstrating how that process occurs.
There's very convincing animal studies. Yeah, we don't have human studies, of course, because that's a lot more difficult, but there's certainly convincing animal studies, and many of them, that show that we can trigger, rather than the tendon connecting to the bone with scar tissue, but the tendon connecting to the bone with a proper enthesis, with a proper structure that's strong.
And then again, for our listeners and those that are out there, it's agnostic to the other stuff you're going to use, right? You're going to put this stuff into the bone where we want it to heal, and then you can use sutures and anchors of standard stuff. So you're a biologist and a mechanic. I mean, I would respectfully argue I have had great success with the BioBrace implant from ConMed. I also use the Anika Integrity Graft now, which has HA. And again, Bill's been a part of those studies as well. But I think we're still saying the same thing at the end of the day, encouraging the body to create a healing response where previously we weren't very good at it.
Yeah. And look, this prosthesis does not complicate the actual operation. The way it's been designed, it's very robust. It's very straightforward to actually place into that interface. And we're talking about arthroscopic surgery. These things can become very complicated and very difficult. And that just increases, if things are complicated and difficult, that increases issues for the patients, whereas this doesn't. It's actually very straightforward to put in.
Yeah, and your results are great. I know you have MRI follow-ups at this point.
Yeah, we're following them all now. We are looking very carefully. Our retail rate is looking really good, and the MRI scans that we're looking at post-op are showing the tendon going from becoming very. The tendon changes on the MRI scan from being edematous to being non-edematous, and you see that change. We're seeing very good signal characteristics from the tendon as it's joining onto the bone, as it's healing.
Yeah, and now you brought up a really great point. Like, we were 60% success rate, but I really wasn't telling the patients that because who would sign up? But I didn't actually realize what that retail rate was.
Yeah. was
Right.
only
No,
when
of
I
course.
started looking at it because I was seeing these re-tears, and this is 15 years ago,
Yeah.
and these papers were coming out, and I was going, really? Is that what's, I was right at that time when the papers were coming out showing these re-tear rates because people were actually starting to look at it, and we're seeing these re-tear rates, and they're astonishing. And all right, people do okay if they've had a rotator cuff repair and it doesn't work all the time, but you know what gives the best result? An intact rotator cuff repair by far. You
Oh,
can
agreed.
restore these people, and no, this we talked about me going from neurosurgery to shoulder surgery, and people ask why do you do that? Well, the neurosurgeons have some great wins, but they're a bit few and far between. With shoulder surgery, and no one thinks about their shoulder. It's not like the brain; everyone worries about their brain, but the shoulder, they don't think about it, but then it's sore, and you know what happens? They can't sleep at night time. They can't go to work. They can't go to the gym. And you know what? They think about their shoulder all the time. And the wonderful thing about being a shoulder surgeon is you can actually fix that for them, and you don't save their life, but you give their life back to them, and that's a wonderful thing. And they stop
Com-
thinking about their shoulder
So,
again.
so well said. I completely agree. What I was going to say is, I've been using the CONMED BioBrace implant.
Yeah.
And again, we can respectfully disagree as far, but
Yeah.
now I track my patients. I've done
Yeah.
250, and I can literally quote a 93% success rate on following my patients with the use of this implant. And I have incredible confidence now as I say that to the patient based on the decades of history that you and I have shared,
Yeah.
with our
Yeah.
previous results.
Yeah. Yeah,
So,
look, rotator cuff tears are becoming a very rare thing in my practice, and everyone gets scans, so we see them. I actually know what's going on, and it's really exciting to be part of this. And if we can improve then the strength of that repair, so we give them back a normal shoulder that they can then go to the gym and do all the sports. Because people ask, all right, you're going to repair my rotator cuff. People know surgery isn't perfect. And, will I get, all right, you've told me I might be able to sleep, but will I be able to get back to the gym? Will I be able to get back to playing golf and tennis and everything else? And because, it is nice to be able to say, well, look, if we go down this pathway, we're going to be able to give you a pretty damn normal shoulder. Pretty cool.
well, look, this is my podcast, so I'm allowed to do a little self-promotion here. So I'm going to give a shout out to a couple of other Brisbane Aussies that I adore, and that's Kate Perkins and Catherine Norton, who own a company called Oncolaser, and they're using photobiomodulation therapy, similar laser that we're using in the musculoskeletal space to be able to treat patients that have the sequelae of cancer. And so I'm actually on an advisory board in Australia, so I share that. But I'm going to have them reach out to you, and I think they know you. You've got to start thinking about using a little photobiomodulation therapy over the shoulder zone where the repair is, because we can increase metabolic activity, cellular response, and we can actually potentially improve the healing rates with it as well. So we're going to school you on that. So you're going to probably
Right.
get a phone call, but don't worry about
Right.
it.
Look forward to it.
I love it. Listen,
Yeah.
Ken, this has been fantastic. It's always a pleasure for me to meet other master surgeons from around the world that just have been through a very similar journey on their way to being able to truly take the best possible care of their patients. We so admire your passion for education, for medical device design, and for really keeping everybody on their toes and maintaining an international brand. It's just so awesome. So well done, brother.
So good. So great to chat again, Scott. Wonderful.
We're
Thank
looking
you.
forward to sharing your story just in a matter of a few weeks. So all of our listeners will know it's a fresh episode for sure. So this is
Good.
Dr. Scott Sigman, hashtag follow the fro, host of the Ortho Show. Till next time.